Women are the fastest growing group of U.S. military veterans. Historically, the Department of Veterans Affairs served a veteran population that was overwhelmingly male. But now the VA is working hard to create a system that can meet the unique healthcare needs of our women veterans.
Our role is to change the culture of the VA, to have the VA be more conscious of women veterans and plan for that day not too far around the corner when 1 out of 10, 1 out of 6 people who come to the front door are women.
Women have come to our center, and my patients tell me it's just so amazing that the changes not only in the last 10, 15 years of the VA, but the last 12 months.
I got involved in women's health care in 1994. There's no place in this institution for women to get annual gynae exams, no place for them to get contraception, no place for them to have their menopause managed.
When you came here and you were a woman, you were kind of isolated, and you were kept away from the other patients.
You really did feel kind of alienated when you walked in the door.
Going there as a 20-something blonde, it was very hard. I actually stopped going to the VA for medical care for many years because it was so bad.
The effort to transform women veterans' health services to a model of comprehensive care involves hundreds of VA health professionals at all 153 VA medical centers and their community-based outpatient clinics in the United States. A women veterans program manager at each medical center works to improve the overall quality of care provided and connects women veterans outside the VA to the healthcare services they need and deserve.
We have dedicated space and centers just for women veterans so that they can make that easy transition in a comfortable environment with women providers.
Well, comprehensive means that every provider is prepared to offer the very basics in women's health.
Your diabetes, your hypertension, your asthma all managed.
Eye care, I get allergy shots. I have neurology for migraines.
Screening breast exam, pap smear, initiate oral contraceptives, menopausal care.
When the woman is seen, she's able to be seen for the whole scope of the issues that she has.
Women are much more on the front lines of service now than they ever have been before, and that brings with it a whole new set of emotions and difficulty. And we really look closely at the readjustment, how they came home and how they're doing spiritually. We pull in the chaplain service if we need to, social work. We have a lot of homelessness.
We also have counselors who can talk to women about military sexual trauma.
It's a huge issue and has many, many health consequences. And if not dealt with, the underlying medical problems are never resolved.
Services are also throughout the VA system for the issue of post-traumatic stress.
I just remember it being really desperate, and I didn't really feel like I had any other choice but to access the mental health care.
I just saw so much that really, was too much for me.
Before the injury, I was a very active person. I was always running, doing step aerobics. When I realized I couldn't do those things anymore, I really didn't see a point on why I was around. Someone told me to come here. They just welcomed me with open arms. If it wasn't for them, I don't think that I'd even be stable. I love the people here. I really do.
There are different models for women's health care in different VA facilities around the nation, but all have interested, competent providers offering basic health care services for women.
They need to be able to come to clinic and have all of their care met in one-stop shop, and that's the golden key about patient-centered medical home. When you come in, you'll see a provider who's proficient and interested in your care, whether you come into a community-based outpatient clinic or you come to a facility where we might have a larger women's clinic.
The VA priority for patient-centered medical home has created an ideal complement for providing comprehensive care for women veterans. Patient-centered medical home provides health care access to women through a coordinated, team-based approach.
The providers are excellent, the staff is friendly, the women's clinic itself is very nice. It's off to itself, so you don't feel overwhelmed with everyone being around you.
They listen to me. If I have any questions, they answer them. They don't try to brush me aside. I'm thankful.
The VA is also working to reach out to women veterans who may not be aware of the healthcare services that are available to them.
I didn't know anything about it. I thought it was just for retirees or active duty.
It was a lot of what the other soldiers were saying. That they were saying it was horrible. Don't go there. They don't really care.
The first step for women leaving active duty or women veterans who are not now using VA healthcare services is to enroll at the nearest VA facility.
It will provide you a sense of security that when and if you ever do need the VA, you're enrolled. You don't have to worry about anything. There's no charge. It's a benefit that you've earned.
Take advantage of it because, that's what the VA is here for, is for us.
We provide the best care, and we would love for all our women veterans to come.
This is so great that there is a place like this that is welcoming and makes you feel really good about your VA system. It's fantastic, fantastic.
The reaction we get from women is so positive. They really are surprised and pleased with the care that they receive here.
Come into the VA, get your care. I promise you, by a long shot, it'll be way better than how you feel now.
The VA Women Veterans Health Program is working hard for you, our women warriors, because you served and you deserve the best care anywhere.